Well, being a women's health nurse practitioner, I am vigilant about doing my mammograms. I do what I preach to my patients. And so my mammograms have always been normal. My 2013 mammogram was normal. My 2014 mammogram was not. I had an aggressive breast cancer because I didn't have anything in 2013. So by the time I had it in 2014, that's an aggressive breast cancer. I had 3 breast biopsies. Went back for a repeat mammogram on a Friday morning, had 3 breast biopsies on Friday afternoon. I knew that the one was going to be positive because I saw it on the screen, and I know too much, you know. And so when I had the 3 biopsies, the one was positive for breast cancer. I already knew that, so when they called me, it wasn't a surprise to me. Mm-hmm. My daughter is a physician, and so she got me into Dr. Goulet at Community East in Indianapolis, who was one of the best breast surgeons in the country.
And what's your daughter's name?
My daughter is Jessie Clark, Dr. Jessie Clark.
Okay, and Dr.
Dr. Goulet.
Goulet.
Just like Robert Goulet is
Just
his
like
name.
Robert. Okay.
Yes, at Community East Breast Center. Mm-hmm. I was in there within a week of having my biopsies, even before the week of my biopsies. Here is I think, something that is a divine intervention. Okay, he went through all my options, and every woman is different. I mean, every woman has their own plan. Okay, their own team of healthcare providers. Being a healthcare provider, I like to be in control. Mm-hmm. You know, it's different being the patient than being the provider.
Sure.
And so my choice was to have double mastectomies with reconstruction. And that was an option, so that was okay. I made my choice. Mm-hmm. I saw oncology that afternoon, which really kind of floored me because why I didn't think I'd have to do any type of treatment, I don't know. But when you're the patient, it's completely different.
So you were still in the hospital and oncology came in to see
I wasn't in the hospital. I'd gone to see Dr. Goulet as an outpatient, and then he orchestrated me seeing oncology that afternoon. And my oncologist, the whole team is great. And he said, you will need chemotherapy. So if your decision is to have your mastectomies first, we'll do your chemotherapy after your surgery. Okay, that was my plan. That was on a Thursday or Friday. On Monday, I get a call here from my oncologist early in the morning that said, well, we can't get you on the surgery schedule till January. I am not going to let you sit for 2 months, because this was in November. I'm not going to let you sit for 2 months and do nothing. So you're starting chemotherapy on Thursday. I was devastated. We were still in that devastation. I mean,
Sure.
You know.
My wife has breast cancer, by the way, so
okay.
I can relate to what you're saying.
Okay. So we were still kind of in that everything's coming at you very fast, and you can't catch up with your thoughts, and it's like, oh my gosh, you know. So of course I call my husband and tell him, you know, briefly, here's the divine intervention. I walk into the house that evening, and I said, of course I walk in, I start crying. He gives me a hug. He says, honey, I know you never thought you were ever going to have chemotherapy. I know you never thought you were going to have chemotherapy this week. But I think you're more upset that they changed your plan. And that very minute, that's why I say it was divine intervention. I think that was God talking through my husband. Mm-hmm. And I stood back and I said, you know what? You're right. I am not in control. I'm going to be where I need to be, when I need to be there, and I'm going to do what I have to do. And this is in my team's hands and God's hands, and I am not in control.
And that's hard for you.
It's very hard for me, because anybody that knows me knows I got to have a plan, and I like to be in control. So at that moment, I felt better. Now, I don't know if that makes sense, but I felt better. Yeah. I started chemotherapy that week. Mm-hmm. That was the middle of November, end of November. Well, it was before Thanksgiving. So
2 months before you had surgery.
Yeah. So I did 4 chemotherapies, once every 3 weeks. Got a little break, an extra week over Christmas because it was our New Year's, because that's when I fell. Fell during that time, so they had to extend. That's when I should have had chemo. during the week of New Year's. And
Was your fall connected?
no, I did not fall. That's when chemo would have been scheduled. I'm sorry, I used the
okay.
wrong word.
I understand.
And so my chemotherapy ended the end of January. 3.5 weeks later, I had double mastectomies with reconstruction, which is amazing, totally amazing. I went into surgery at 11 o'clock on a Tuesday morning, and I was sitting in my living room at 11 o'clock on Wednesday morning. Is that amazing? Totally amazing.
That's what my wife went through, too.
Mm-hmm. I was off work for 6 weeks, did fine. Reconstruction is a process, so that continued for 6 months.
Where did you have the mastectomies done?
At Community East.
Community East, okay.
Yeah. Dr. Robert Goulet did the surgery.
That's right.
And then Dr. Michael Stolnicker was my plastic surgeon, so that's a 6-hour surgery. It's easy for me. They put me to sleep and I wake up and it's over. It was hard for my family,
Sure.
you know, and so all my family was there. And then I just had surgery again in August to put the permanent implants in because the process are spacers. And so anyway, I'm good and cancer-free, and I've been cancer-free for 7 months now. And the thing that got me through were my family and my friends and the prayer list that I was on. I think I was on every prayer list in Indiana and across the country because I have nurse practitioner patients and friends everywhere. The patients here were unbelievable. I mean, I don't know if you understand this, you probably will. I could feel the love and the prayers,
Sure.
and it's humbling. It's very humbling. And my faith. Yeah.
Yeah, as the poet said, there's more than this world dreams of.
Yes, there is.
You mentioned your family.
Mm-hmm.
In what ways were they supportive, or maybe you want to say what ways would you rather they have been supportive?
My family was tremendous. My husband and I have been married for 7 years. So I knew 7 years ago when this man came into my life that he came into my life for a reason, but I didn't think it was this reason. And he is, there's not words, I don't have words to explain how supportive he was. I mean, we were both devastated.
Sure.
But it was, you know, his thing was, I want you to be alive, you know. And he was with me every step of the way, went to every chemotherapy with me except one because he had a trade show he had to do. Went to every appointment, very protective, wouldn't let me go anywhere hardly by myself, was really worried about me working and doing chemotherapy, so I wore a mask a lot, and then I'd come home and he'd say, did you wear your mask? Everybody was very protective. My daughter being a physician, you know, I thought, you know, she would not be as, let's see, how do I want to say this? When you're a healthcare provider, you kind of see things through a different light. And so I find out after everything was over, when we were talking to friends one day, that she said, when my mom got diagnosed with breast cancer, I thought she was going to die. Mm-hmm. Being a physician, and because I had such a great team at Community East, and they have a nurse navigator, she went to that first appointment with me thinking that she was going to have to navigate appointments and help me help me orchestrate the system. And she was very grateful for that team because she said, I could be the daughter.
Mm-hmm. Now, what's your husband's name?
Charles.
Charles.
Mm-hmm. Charlie.
Charlie.
And so my daughter was there every step of the way.
Charlie Potts?
Yes.
Okay.
Yeah. She was there every step of the way. If she was in the hospital for some reason, she would come by chemo with me. We always went out to lunch after chemo. That was always the thing we did, was go out to lunch, you know. My son...
It's amazing you felt up to doing that.
Yeah, you know what? You don't feel bad the day of chemo. You usually don't feel bad that day.
Uh-huh. It's
usually the next day and the next day. So, except for one of the chemos, I was able to eat lunch afterwards, you know.
Really?
It didn't really hit you till the next day. My son is a golf pro, and so he is not medical. He's just medical by osmosis of, you know, being around me and everything. And he grew up in that time that I had breast cancer because I think he thought I was going to die.
And what's his name?
Jacob.
Jacob
Peacock.
Peacock.
Yeah. And so he was always there. When I had surgery, when I came home from my mastectomies, he lives in Indianapolis, and he came that afternoon, brought food, stayed, most of the evening just to be there. So that,
Could I ask which, I don't want your address, but which community do you live in? Do you live in
I
Brazil?
live in Brazil.
Brazil.
Yeah. I live on the backside of the golf course.
Could I ask your age?
I'm 58. I was 57 when I was diagnosed.
Okay.
Yeah. No breast cancer in my family. None.
Really?
None at all. My friends, everybody brought food on the weekends that I had chemo. Everybody was supportive. I don't know how else to say that.
And what do you look to for the future?
For me?
Yeah.
Well, my breast cancer was triple negative in the beginning.
What does that mean?
Which means I was estrogen, progesterone, and HER2 negative, which means they couldn't give me anything to block it. That's the most aggressive breast cancer there is. Now, it was localized. It wasn't in the lymph nodes, so I don't have any metastasis anywhere else right now that we know of. But when they did the mastectomies, I still had part of the tumor left, and it was estrogen positive. So now they can give me a medication to block the estrogen. Okay.
That's what my wife's taking.
Okay. So everybody was doing backflips because, hallelujah, we can give you something.
Yeah.
So right now my surveillance is I see my breast surgeon every 3 months. I see the oncologist every 6 months just for a checkup. There are no scans or blood tests or anything to do to find out if I have it anywhere else. We're assuming I don't. And it goes by symptoms, I've always been healthy, thank goodness. And so that helped a lot because I didn't have any other disease processes going on. I felt like crap during chemo, but I was told in the beginning that chemo is not a walk in the park, but it's also not what you see in the movies. And that is so true. And my husband and I looked at each other. I can't tell you how many times and said, if this is as bad as it gets, we're okay.
And did it? Was it?
It was.
As bad as it got?
It was. I did fine. I had chemo on Thursday. I had to go back up on Friday for another injection. The weekend was usually not good, but I had different symptoms after every chemo, and I was at work on Monday morning.
Wow. Except
for the very last chemo, and I missed that Monday morning. But I worked 4 days a week. And they were great here because what happened was I would see my patients in the morning. I would get an extended lunch so I could go home and rest. And I saw my patients in the afternoon. So that little bit of rest in the afternoon really helped me get through the day. And that's that's the only thing I wanted to do was just get through my day, When I went to the oncologist, the first meeting with the oncologist when he told me I had to have chemotherapy. And of course you have to remember I was still in that crying all the time, devastation, couldn't really hear.
Yes.
The first thing I said was, how am I going to take care of my patients? How am I going to take care of my patients if I'm going to have chemo? And he said, you can still work as long as your counts don't drop. And thank God my counts never dropped. And so they kept the sick patients. I didn't really see sick patients because they didn't want me exposed to them, but I still got to work and see my patients. I didn't know whether I had lymph nodes involved until I went to have my mastectomy. So my anxiety got more and more and more and more. Yeah. And that's what my family's anxiety was, waiting, So when the surgeon came out and told them that I didn't have any lymph nodes involved, we were all, elated. Yes. And so that really dropped. Now, I don't let my mind go to, well, is my hip hurts, is that bone cancer? I've got a cough, is that lung cancer? Geez, I can't remember something, is that brain cancer? I don't let my mind go there. And my whole philosophy has been that if something else happens, I will be upset.
Sure.
But
Absolutely.
I will get through that being upset, and then I will do whatever I have to do to fight. And so I really think it's all in the attitude. I'll tell you one thing I did leave out was that I think is important. That whenever, I think especially women, but probably men too, whenever a woman is told they have to have chemotherapy, what is the first thing they think of? You're going to lose your hair.
Yeah.
And in that conference room, when he said, you're going to have chemotherapy, I was hysterical. Now, why I didn't think of that? I didn't think of that. I was hysterical. And Dr. Goulet is such a wonderful physician. He was just, let's take a break, just take a breath a minute, let's regroup. And I said, I'm going to lose my hair. I'm going to lose my hair. And the minute I said it, I knew how vain that sounded, but that was important.
No, it doesn't. No.
So I got through that, and my nurse navigator was wonderful and sent me to a place to get a couple of wigs, and we had 2 wigs, and they were great and everything. But this is what I did, and I made up my mind. I told my husband, when my hair starts falling out, I'm going to shave my head, and we're going to have a party. And so I had my first chemo, and I kept pulling on my hair because it wasn't falling out.
Yeah.
And so at day 10, it started falling out. That was a Tuesday. I had my hairdresser on standby. My friends knew.
Yeah.
We had probably about 20 to 25 people on a Sunday afternoon at my house. Food, drinks. Everybody got to be there, and we shaved my head.
Mm-hmm.
And that was important for me. But it was also, I wanted my family and friends to be there when it happened so they weren't afraid. But it was such a fun day, and in my mind it made something that I thought was going to be devastating. It made it a fun thing. And then my friends weren't afraid to see me. And they weren't afraid of, what am I supposed to say, And that I think, helped everybody through the whole process. I tell you what's a little difficult for me now, probably because it's still so new, is when I diagnose somebody with breast cancer. And what this one thing it has done is allowed me to be a better practitioner, because I diagnosed women with breast cancer and then I never knew what happened over here. I sent them on, and I didn't know what happened. Now I know what happens.
Yeah.
Even though everybody is individual, some of the same things may happen.
Right.
So every time,
Well, as I just said, there's
Yes.
parallels in our experience.
Exactly.
Yeah.
And every time I diagnose somebody with breast cancer, I get upset. And it takes me a little bit of time after I've seen the patient, because I send them on and then I have them come back and talk to me, and I try to give them some guidance and, get them to where they need to be, where they want to be, and kind of let them know what the experience might be. Be prepared for this, if they can hear it. And I always cry every time afterwards. I come out and I have to regroup, because...
Now, what exactly is your job title?
I'm a women's health nurse practitioner and a family nurse practitioner.
Okay.
So I see a lot of women.
Well, you were talking about
Mhm.
diagnosing, and so I thought, well, I missed something here.
Yeah.
somewhere.
No, nurse practitioners diagnose, treat, and prescribe. So,
Okay.
yeah. So,
Do you belong to any organizations affiliated with the American Cancer Society?
I don't. I belong to the National Women's Health Practitioner Organization. I belong to the AANP Association. I can't tell you what those initials stand for right now. AANP. I belong to the Nurse Practitioner Organization in Indiana. It's called CAPNI. I'm working on my doctorate, so I'll be done with that in May.
Good for you.
Yeah, I teach at Indiana State, so I'm busy. I'm busy.
Well, yes, and the fact of the matter is, being a nurse practitioner and to be a doctor, you're part of the team.
Yes.
The rest of us have to find ways to be part of the team, but you're there.
Yes. Yeah. And in some ways, being a nurse practitioner helped me in this situation. In some ways, it didn't, because I knew too much. Sometimes when you know too much, you can also be more scared. you know.
Yeah.
But knowledge is power. That's what I've always believed. So, you know, I want patients to know that.
Absolutely. I believe that fully.
We all think, oh my God, I'm going to die,
Yes.
you know.
Yes.
And we all know we're going to die someday, you know, but the reality of that. And my nurse navigator looked at me and said, you're going to die someday, but it's not going to be from breast cancer.
Yeah.
Whether that's true or not, that's what I needed to hear.
Yeah.
I needed to hear
My wife
that
has told that too.
Yeah, at that moment.
Do you keep a diary?
I do. I started a diary.
Have you shared that with your husband?
I haven't, no.
Yeah, Linda hasn't shown me hers either.
My goal, which I don't know if I'll ever do it, is to write a book. And you know,
you'd be in a unique position. You'd have a very good position to do that.
Mm-hmm. And I started it in November when I got diagnosed. And you know how you kind of wax and wane on things. You know, when things are kind of going well, then you don't put a lot of things in there. I probably haven't. Well, I updated it in August after I had my surgery then. Mm-hmm. But my whole thing is women have to have their mammograms. They have to have their mammograms on a yearly basis when they're in that age group. Then you get their yearly basis. And it's okay to be devastated. It's okay to be scared. But then, you know, it's just my personality that then I face it head on. And it's the positive thinking. And I really don't think negatively, you know. That's just how I am. I'm just not one of those people. And to be a fighter and believe you're going to win and faith in God. Here's something that, you know, I think of things I left out, but just kind of an important thing. So I go back for my callback mammogram, okay? It's a Friday morning at 7:30 in the morning. I'm at Claire Fairbanks. They're great and wonderful also over in Terre Haute, Claire Fairbanks Center for Women. Dr. Ann Windecker was the interventional radiologist there that I knew well as a colleague, and she's read all my mammograms. So I get there at 7:30, and there's nobody in the waiting room. You know, the staff's just getting there, and I check in, and I sit down. Now, I don't have any idea. I've had a couple of callbacks over the years, and all they have to do is compress a little bit, and things go away. Okay,
sure.
That's not a big deal to get called back.
Sure.
So I'm not thinking anything. Right. I'm thinking it's fine. I sit down, and I look up, and there's a magazine rack there. And the first magazine that I see is Joan London bald, because she had just been diagnosed. I look up and I see Joan London bald, and the next magazine up says Living with Cancer. And at that moment, I just kind of went, oh, I wonder if this is the beginning of something. That's the first time the thought ever entered my mind. Never thought I was going back.
And this was before your diagnosis?
I'd had my regular mammogram. Yeah. They'd called me back for a callback, is what it's called. So I was sitting there and saw those two magazines.
Wow, I think the Lord was in that too.
I do too. And I'm sorry I forgot that in the beginning of the story, but it was a big impact. You know, that was the first time, because we had just been on vacation, and I knew I was having a call back. I got called right before we went on vacation, and so I waited till I got back from vacation to go in for the callback mammogram, and I didn't think anything about it on vacation. I didn't think, I just did not think I had breast cancer. And I just want women to I've always been, my whole life, as a professional life, I have been very much a proponent of women's health care, preventative care. Women have to get their mammograms. I mean, my patients come in for a sore throat, and I say,
okay, your mammogram.
Now, when was your last mammogram? and they know that's how I am, you know. So I'm like, oh, when was your last women's health exam? Oh, I haven't had that. Okay, well, let's get you back in and get that done, you know. They just know I'm like that, you know.
I have one more question for you. When you become a physician, are you planning?
I won't be a physician. I'll be a doctorate of nursing practice. I'm getting my doctorate in nursing.
Okay.
I'm a nurse practitioner.
Right, and you're going to have your doctorate in nursing.
Right.
Will you specialize?
No, I already have my specialty is women's health care.
Okay. And you'll continue in that.
Yes, women's health care and family practice. And my doctorate of nursing practice is called a DNP, is a clinical doctoral degree. So,
okay.
Yeah. And, you know, so I'd like to write a book, and I'd really like to start speaking to groups.